Well, we are tackling an important issue tonight, but it just might make you a bit squeamish: oral fecal transplants. Now, before you turn away, and I totally understand the grossness of all this, you have to know how important these transplants are to people who are seriously ill with an infection called C. diff. It is tonight's For Your Health.
Kelly Poole can joke about it today.
One of my girlfriends says, you might want to brush your teeth, your breath smells.
Last fall, though, Kelly wasn't laughing. She came down with severe cramping and diarrhea that lasted for weeks. After several rounds of serious medication with no improvement, she got the diagnosis.
He said, well, I bet you have C. diff. I mean, he knew almost immediately. He said they've seen an increase in this with antibiotic users.
C. diff is a very serious infection affecting about 500,000 people a year, and it looks like this. Well, after a couple of months, Kelly finally met Dr. Monica Fisher, a gastroenterologist with IU Health.
So nice to see you.
Dr. Fisher explained that Kelly could enroll in a study at IU Health, which looked very promising, but Kelly would have to consent to swallowing fecal matter, or poop, in the form of a capsule.
I mean, I was a little taken aback. I was aware of the process. I just didn't realize that we were going to go there so quickly.
Kelly said yes and swallowed 30 blue capsules filled with frozen poop. It took her about 7 minutes to do it, and there were some obvious questions.
How is it not poisonous, or where she wouldn't get E. coli? How do they process this so that you're not really eating real raw poop?
Even if you would eat real raw poop, it wouldn't be poisonous.
The bottom line, the healthy bacteria from the donor fecal material repopulated Kelly's colon. That healthy bacteria was able to fight off the C. diff. She said her life changed overnight.
And the next day I got up and went to the bathroom, and it was like nothing was ever wrong. It was completely normal. Wow. It was actually, it was awesome, actually, after being that sick for so long.
Since then, Kelly has endured plenty of jokes, but the bottom line, she is cured, and a fecal matter transplant did the trick.
Another FDA study is starting this summer, and this time patients will only have to take 2 or 3 of the fecal matter pills. That will certainly make it easier on patients, and it's hoped just as effective as the other methods.
There's nothing like music to soothe the soul. And what better spot than the place where patients and their families are hurting?
Pain, we're all going to go through it, whether it be pain from some situation that we're going through, and being able to be wrapped up in this, like I said, sometimes distracts you from whatever it was that brought you here.
These concerts are a gift from Marianne Tobias. She gave a piano to the new hospital, and through her music program has attracted world-class musicians like Pavel Polanco Safadi.
I remember one patient, they had problems walking, and he was walking and dancing at the same time. So it's, music can be a healing, tool for many people.
Chief neurologist Dr. Robert Pascuzzi fully endorses this music program at Eskenazi. He's seen its healing power.
It may actually channel you to a whole world of memories and events that you haven't considered for decades. And so the brain has a tremendous capacity to store information and life experiences.
In fact, Dr. Pascuzzi believes the role of music in healing ought to be studied more thoroughly.
That's the role of research in a neuroscience community, to figure out what does music do to the brain, how does it engage other parts of the brain, in what ways is it therapeutic, can we measure that?
Until scientists can discover it, these free concerts will do the work of lifting spirits one person at a time.
Joint replacement surgery is commonplace. We all know that these days. But if you are obese, if you are diabetic, or you have some underlying health problem, many doctors will turn you down for a new knee. We found a Bloomington woman, though, who did get a new knee thanks to a surgeon who told her that her risk factors were manageable. It's tonight's For Your Health.
Bonnie Clendenin has known for 5 years that she needed a new right knee. She just couldn't find a surgeon who would do it.
One said, I wouldn't do it if I were you. Another one said, don't even think it. And then another one said, I could do it, but you'd be a very high risk. And then I just kind of tabled it.
In fact, Bonnie is high risk. She has peripheral artery disease, swelling and pain in her legs. Her son Rob refused to give up. He heard about a surgeon at IU Health who specialized in high-risk patients.
I really feel bad for a lot of these patients.
This is Dr. Michael Meneghini. He had no qualms taking on Bonnie because he and his team have come up with a nationally known strategy to manage high-risk patients.
For our high-risk patients, what we have done is extended an oral prophylaxis, just a pill, twice a day for 7 days. And what that does is protect the patient in that early high-risk postoperative period. It minimizes their risk of infection and wound complications.
He also asks them to use a special soap to kill bacteria before the surgery. If they are overweight, he asks them to diet. And if they're diabetic, his team helps the patient get the diabetes under control.
Let's meet us halfway, right? So you may not be able to cure your diabetes. You may not ever be able to be, skinny. But what we need you to do is optimize those medical conditions.
Bonnie had her surgery July 9th and has promised that we can check on her to see how she's doing in several weeks.
I'd like to be able to walk without a cane and walk with ease.
And hopefully she will get there. Dr. Meneghini is confident about his approach because the data proves it. He says his infection rate in high-risk groups that he treats was only 0.5%, and that is better, he says, than the national average.
When we first met Bonnie Clendenning at IU Saxony Hospital in Fishers, she was confined to a wheelchair, and she told us the story of being turned down for a knee replacement.
One said, I wouldn't do it if I were you. Another one said, don't even think it. And then another one said, I could do it, but you'd be a very high risk. And then I just kind of tabled it.
This is Bonnie 4 weeks after her total knee operation was done. Walking, no crutches, and no cane.
Now it's good. I know that I'm very blessed, and I feel very happy that I was able to have it done, and I have no regrets.
Bonnie is a high-risk patient. Her weight is an issue, and she has peripheral vascular disease. But her doctor, Michael Meneghini, knew that and put her on a protocol before surgery to reduce her risks.
We're fortunate that our program has been able to mitigate those factors. She was medically optimized before surgery.
Essentially, she improved her diet, she used a wound vac on her incision, it's a special suction dressing which acts like a barrier to germs, and she took antibiotics after surgery. When we met her, Dr. Meneghini said she had no restrictions. She was good to go.
I can even walk without the cane and without the walker now.
It might look like a cooler you'd take to the Indy racetrack, but this little red bag could be the answer to better health for just about everybody.
We want to reset the standard of health care, and this is a great way with very simple things we do it.
Dr. Bill Wooden is on fire about this red bag. The idea started in Europe. IU Health has made some changes, but essentially it contains the basics to kickstart a fast recovery, and every surgery patient gets one.
It's well known that if you become stressed, that if you have a trauma, and a surgery is a trauma, your immune system turns off. We recognize that arginine, which is an amino acid, is key to reversing that.
The arginine is contained in a Nestle product called Impact. A case of Impact goes into every red bag. Patients like Jay Barker drink it 3 times a day, and her recovery from surgery was quick.
1 week after surgery, I was able to walk a half mile. Yesterday, 10 days or 9 days after surgery, I walked a mile, and I felt good. Nothing was hurting inside.
The bag also contains a spirometer, so patients practice deep breathing. There's a special soap called HibaCleanse to kill germs. Patients are told to quit smoking, exercise more, and drink Gatorade even the morning of the surgery.
What that does is it keeps you from getting dehydrated, which makes you feel better, and it helps stabilize your metabolic functions.
Dr. Wooden feels so strongly about this red bag approach, he'd like versions of it available to just about everybody.
These basic, simple things, if we think of the power of how many, literally hundreds of millions of dollars that this will save Indiana, how many billions of dollars it could save at the national level, and how easy it would be to then bring that back to after-school food programs, community food bank programs.